Good morning, my name is Brittany and I would like to introduce to you the members of our group, Anabelle, Roisin and Fala. Today I will be speaking about the context that we have chosen to base our research on, as well as identify two of the social determinants of health related to cardiovascular disease. Roisin, our second speaker, will be speaking about the health need that we have chosen to base our research on, and she will also be discussing the culturally competent and safe nursing practice as a registered nurse in these situations, and finally provide a summary of how this research has transformed our nursing practice for future improved Aboriginal and Torres Strait Islander health in the future. Our third speaker, Anabelle, will be providing an overview of the health issue we have selected, as well as two social determinants, access to health care services and physical environment, and finally provide a conclusion based on all the research. Our final speaker, Fala, will be presenting a video on the link between culture and health and discussing this in detail. The context our research is based upon is rural Aboriginal and Torres Strait Islander communities based in Northern Territory. To provide a brief background, the Australian Bureau of Statistics suggests that there are currently 58,248 people of Aboriginal and Torres Strait Islander descent residing in Northern Territory, which has evidently risen since 2011 by 1,469 people. Currently, the Northern Territory is one of the states or territories that have the highest amount of Aboriginal and Torres Strait Islander people compared to New South Wales. The Northern Territory Government are providing essential services to more than 72 remote Indigenous community in the Northern Territory.
The need that we have chosen to focus on is health promotion. Health promotion can be defined as a process of enabling people to increase control over and to improve their health. It can involve a wide range of social and environmental interventions. Health promotion is about improving health and doing this through teaching people about their health and how to live a healthy life. So why is this healthcare need significant for the Aboriginal and Torres Strait Islander communities? These communities statistically have poorer health than non-Indigenous communities, shown simply through the difference in life expectancies. Indigenous Australian communities are estimated to have a 10-year less life expectancy than non-Indigenous Australians. It is reasons like this that it is important for this community to learn about their health. While information is readily available, people are willing to teach and they still have time to turn their health around. Statistically, health promotion has shown in the past to impact on Indigenous Australian communities. The Closing the Gap campaign is a health promotion campaign that has impacted the community. From 2003 to 2011, the total amount of Indigenous Australians with disease fell by 5%. The rate of child mortality has declined by 35% since 1998. These are two examples of how health promotion can impact the Aboriginal and Torres Strait Islander community, and if similar strategies continue, then the community can and will continue to improve. It is not only the Aboriginal and Torres Strait Islander communities that benefit from current healthcare policies and practices. Through policies, not only is health being improved, but it can be seen as the Australian government attempting to right and fix the wrong of their predecessors, who essentially caused these health issues to occur in the first place.
Cardiovascular disease, or CVD, refers to a class of diseases that involve the heart or blood vessels. The most common types of this disease include heart attacks, strokes, or high blood pressure. Cardiovascular disease is mostly caused by modifiable risk factors such as smoking, obesity, a diet high in fats, physical inactivity, and high alcohol intake. This disease is one of the main contributors to the gap of life expectancy for Indigenous people in comparison to non-Indigenous people. This is due to many determining factors which we'll be talking about in the following slides. According to the Australian Institute of Health and Welfare, in 2015, Indigenous Australians were 70% more likely to die from cardiovascular disease than non-Indigenous people. They were also 2.6 times more likely to smoke daily. Additionally, according to the National Rural Health Alliance, the further a person lives from a major city, the higher their chance is of being hospitalised or dying from cardiovascular disease. These differences are largely preventable and stem from the unequal access to the conditions and opportunities needed for good cardiovascular health. Indigenous people view health as not just the physical well-being of an individual, but the social, cultural and emotional well-being of the whole community. Therefore, with cardiovascular disease largely impacting Indigenous Australians, it not only affects the individuals with the disease, but it also impacts the entire community, especially those living in small, remote communities, such as the Northern Territory. Our group saw this as one of the most significant issues to discuss, and we have chosen to explore it in more depth during this assignment. As future nurses, we must understand the factors that can lead to cardiovascular disease, and we must understand how to promote better health and education for Aboriginal and Torres Strait Islanders on preventing this disease. We must also understand the links to the disease between their culture and how to provide culturally competent and safe nursing care for Indigenous Australians suffering or overcoming this disease.
Hi, my name is Fala, and I'll be talking about the links between culture and Aboriginal and Torres Strait Islander health. Before I start my part of the presentation, I would like to acknowledge on behalf of our group that our presentation today is held on the country of the Darug Nation and its people. I'm also honoured to acknowledge and pay our respect to the Darug's people's elders of the past and present. C. Clarke and D. Fuquity said, and I quoted, "When we are able to sit on the land in contemplation and hear, feel and see the spirit of our old people, then we have been to a place within ourselves of great depth and connectedness. It is this place we need to go into in order to truly heal ourselves. And once we have learned how to do that, then we can move forward." Australia and Torres Strait Islander culture have been around for more than 60,000 years, making Indigenous Australians the custodians of the world's most ancient living culture. Land is everything to the Aboriginal and Torres Strait Islander. It is the mother, the source of identity and spirituality. It is the contest of the human order. The land gives them strength. The ancestors that are buried on it look after them and everything around them or on it, because they all connected to each other and they were all from the land. It is a beautiful concept of togetherness and very strong sense of belonging. It is the total opposite of the Western lifestyle, which is very much individualism way of living. We buy land and we make it ours. They believe they belong to the land, and that changes the whole way of seeing life. I hope you agree with me that these two cultures are totally opposite of each other and plays a big role in the next phase of history. Colonization. In 1788, 90% of the Australian and Torres Strait Islander population was wiped out through direct violence and exposed to new diseases. Mothers will have their babies taken away and be taught new ways of living, as referred to stolen generation. The laws and policies by British colonists that was disregarding the existence of the Aboriginal and Torres Strait Islander community. And also Australian Aboriginal and Torres Strait Islander people were taken as slaves and paid cigarettes and alcohol and a few coins they couldn't even spend. Now you start to see the bigger picture of how things changed so sudden. The pain of being taken away and lived in a life they don't know, a food they don't know, and not allowed to practice their culture. I am Samoan and I'm very proud of my culture, and even though I lived in Sydney for 18 years now, I still feel homesick and miss my people and my homeland. This reality of what happened to the Australian and Torres Strait Islander people makes me very sad, and the fact that I only just learned about it after 18 years in living in Australia is even worse, because I've heard and seen it in a total different perspective. The apology. On the 13th of February 2008, Kevin Rudd, the Prime Minister at the time for Australia, made a brave move and offered the Australian and Torres Strait Islander people an overdue apology of how they were mistreated during colonisation. Australia has finally made the first step towards the healing process from this trauma, but it really does take action, reassurance, and support for this process to succeed. Closing the gap is one step towards it. Now you can watch the video of what Kevin Rudd has said on the latest policies and where they're up to with the Closing the Gap campaign.
This year's Closing the Gap report marks 10 years since governments agreed to work together to improve the lives of Aboriginal and Torres Strait Islander Australians. I'm pleased to report that 3 of the 7 Closing the Gap targets are on track this year: the Year 12 attainment target, the child mortality target, and the early childhood enrolment target. Now, while we welcome and celebrate these improvements, there is still much to be done by governments and communities. When I tabled my first Closing the Gap report in 2016, I made a commitment that my government would do things with Aboriginal and Torres Strait Islander people, not do things to them. And we continue to put Aboriginal and Torres Strait Islander people at the centre of decision making in their regions through innovative models like empowered communities. But there is a clear need to improve our accountability and transparency of government-held data and information. We acknowledge the call for better evidence and evaluation over what works and why, so that people can have a say over the services that are provided in their name. And we agree. Today we're announcing a trial of a new Indigenous grants policy that prioritises Aboriginal and Torres Strait Islander organisations to have better opportunities to deliver services for their communities. We have better aligned our policies, programs and data around regions, so as far as possible, we can start to measure the success or otherwise of our efforts. This will allow us to adjust policies and programs where we need to, and adopt and then adapt the key learnings. Underpinning our success is the opportunity to include Aboriginal and Torres Strait Islander Australians in our national economic story. Our Indigenous procurement policy has enabled $600 million of contracts to be awarded to Aboriginal and Torres Strait Islander businesses. Ending this disparity is complex and challenging, and closing the gap is a national responsibility that belongs with every Australian. Only by working together can we achieve the lasting change that our first Australians deserve.
Education, literacy and finances is a social determinant that has significantly impacted on the health of Aboriginal and Torres Strait Islander people, specifically those residing in remote areas of Australia and who have been diagnosed with cardiovascular disease. The lack of education, health literacy and finances are all contributing factors of cardiovascular disease. The Australian government states that studies have found between 1/3 and 1/2 of the health gap between Aboriginal and Torres Strait Islander people and non-Indigenous Australians is associated with the differences in socio-economic status such as education, employment and income. Some barriers to accessing education and health literacy include lack of teaching resources and teachers in remote areas, varying distances to schools in remote areas, lack of health literacy, therefore limited understanding of the implications of various aspects of good health, such as adequate diet and hydration, avoiding participating in excessive tobacco, drug and alcohol use. Approximately 49% of those who have completed Year 12 reported good health status compared to 29% of those who had completed Year 9 or below. It has been recognised by the Australian Government a link between health and education whereby poor health leads to decreased employment rates amongst Indigenous Australians. Similarly, poor health impacts on the ability of Aboriginal and Torres Strait Islander people to complete an education and pursue employment post-qualification. The Department of Health states Aboriginal and Torres Strait Islander adults are less likely to smoke if they have completed Year 12, are employed, and if they have higher incomes. Therefore, it is vital that access to education improves so that education is provided to Indigenous Australians to promote awareness about the importance of good health and ensure prospects of completing education or tertiary education to further attain employment and therefore limit the risk of developing cardiovascular disease. Furthermore, personal health practices have also been identified as social determinants of health that has greatly impacted on the health of Aboriginal and Torres Strait Islander people. This links in with what has been mentioned previously about education, literacy and finances. Some factors contributing to personal health practices include the lack of access to healthy and fresh foods to fulfill an adequate and nutritious diet due to finances and location, particularly for Indigenous Australians who live in remote communities, lack of physical exercise, lack of education and knowledge of various health issues relating to prevention and cure, excessive tobacco and alcohol use, lack of access to appropriate facilities or GPs, therefore resulting in inability to treat illness or be provided with regular checks that may be vital across the lifespan. The Australian Government states tobacco is one of the leading contributors to the burden of disease among Aboriginal and Torres Strait Islander people. Tobacco has been estimated to contribute to 12% of the burden and 17% of the gap in health outcomes between Indigenous and non-Indigenous Australians. Health behaviours such as adequate diet and physical exercise are believed to be a protective impact on health. By educating Indigenous Australians about the importance of being aware of modifiable risk factors such as what has been mentioned, can ultimately limit the risk of cardiovascular disease and therefore prolong the quality of life among rural communities in Northern Territory.
The use and availability of healthcare services is a social determinant that greatly affects the health and well-being of Indigenous people, particularly for those diagnosed with cardiovascular disease in remote areas of Australia. A lack of access to appropriate healthcare services has been recognised as a contributing factor to cardiovascular disease. Some barriers to accessing healthcare services in rural areas include shortages of general practitioners, lack of affordable healthcare services, lack of female doctors in relation to women's health, a lack of awareness of existing services, and a lack of culturally appropriate services. In remote areas such as the Northern Territory, access to adequate healthcare services is very limited, especially for Indigenous Australians who are requiring culturally appropriate services. There are a few other ways that limit the access to healthcare services, which include a lack of services available in other languages, distance to healthcare services, and a lack of affordable transport, as well as difficulty with staying away from home to receive treatment, or a lack of confidentiality. Additionally, the physical environment or living conditions is another social determinant that greatly affects the health and well-being of Aboriginal and Torres Strait Islander people. The physical environment and living conditions of Indigenous Australians living in remote areas varies significantly and is recognised as a contributing factor to cardiovascular disease. Many aspects of the physical environments that Indigenous Australians in remote areas are living in include overcrowded houses, high housing costs relative to income, inadequate sanitation and water supply, little availability to nutritious food and clean air, healthy workplaces and working conditions. These factors can all significantly impact the health of Indigenous Australians and increase the risk of getting cardiovascular disease. Improving the lives of people affected by cardiovascular disease and those at risk among Aboriginal and Torres Strait Islander people is a priority. This is because Indigenous Australians in remote areas are 70% more likely to die from cardiovascular disease than non-Indigenous people, according to the Australian Institute of Health and Welfare in 2015. Therefore, it is a vital need for the increase of availability and access to healthcare services and for the improvement of the physical environment and living conditions in the Aboriginal and Torres Strait Islander community, and more specifically in remote communities in relation to cardiovascular disease.
A part of nursing involves culturally competent and safe care. A definition of culturally competent care involves building an understanding and being open to different cultural perspectives to provide equal care for all people. Safe care can be referred to as providing care that is within the scope of human rights and providing services that are free from harm and done in a humane way. If a nurse was in a rural community with the aim of health promotion for cardiovascular disease, she could demonstrate culturally competent and safe care in a few different ways. The first way could be done through understanding Aboriginal and Torres Strait Islander culture. Having the knowledge about the way that Indigenous Australians live, their customs and traditions, values and beliefs can greatly impact the way that a nurse can understand and better work with this particular group. Another way is through having knowledge about Aboriginal and Torres Strait Islander history. Aboriginal health is greatly impacted by the past generations and the European settlement. By taking that into consideration whilst undertaking this role, it can help to achieve the appropriate care. Second to last way to demonstrate this care is to ensure communication of information is done in a culturally competent manner. The aim is to educate Aboriginal and Torres Strait Islanders in rural communities about cardiovascular disease and the risks/preventative measures one can take to work towards lowering the rate of those who die from it. Educating this group would need to be done in a sensitive manner to ensure that cultural beliefs and practices are not offended or breached. One of the most important ways to guarantee safe care is to ensure safe nursing standards and procedures are practiced. A nurse should always use the correct tools and protocols that are taught and utilised in urban communities and with non-Indigenous peoples. The same principles should be used in this situation as well. As a group, we now know an array of useful information that will help us during our time as a registered nurse whilst working with Aboriginal and Torres Strait Islander peoples. One piece of information that we have gained from this is that being aware of the history of Aboriginal and Torres Strait Islander people is the key to being able to both work with and understand them. If we were aware of the struggles they have faced in the past, we are able to understand the group as a whole and understand the prejudices and challenges this group face. Learning about their history allows us to understand Aboriginal and Torres Strait Islander culture more, and by knowing more about their culture, we are able to care for them in accordance with their cultural beliefs and practices. Other information that we have learned is about how cardiovascular disease affects not only the urban and regional Aboriginal and Torres Strait Islander populations, but also the rural areas. Cardiovascular disease, we have learned, is a prevalent issue for this group, and by us being aware of the prevalence as nurses, we are able to be aware of this and treat accordingly when we come into contact with an Aboriginal or Torres Strait Islander. As a whole, we have learned a lot about the health of Aboriginal and Torres Strait Islanders and their culture, which all interconnect with each other. It is important for us as future nurses to know about all this information as it provides a framework to go by while caring for Aboriginal and Torres Strait Islander peoples.
To conclude our presentation, our group has discussed and analysed the health of Aboriginal and Torres Strait Islander people, with our chosen topics being the health promotion of cardiovascular disease in remote areas of Australia. During our presentation, we explored the links between Indigenous culture and their health, which included their spiritual connection to the country, their cultural traditions, the historical events such as the British colonisation and the stolen generations, and the effect that it has on their health today. We also discussed the social determinants of their health, other than culture, which were education and literacy and finances, personal health practices, access to healthcare services, and the physical environment of Indigenous people. Additionally, we finalised our presentation by discussing culturally competent nursing care and how to conduct safe nursing care practices, in particularly for Aboriginal and Torres Strait Islander people, and why this is essential for their good health and well-being. Now you can find the references we have used on the following slides. Thank you for watching.